Good afternoon. Welcome to the 2026 Brown University School of Public Health Commencement Ceremony. My name is Francesca Bodwin. I'm the Dean of the School of Public Health, and it is an honor to celebrate you, our 2026 graduates. This is our largest graduation yet. Today we are celebrating and acknowledging more than 400 students across all of our degree programs. Yeah, it is impressive. It is also convenient. It is what led us to the Rhode Island Convention Center. And as our undergraduates, where's my wet undergrads at? You have been in the rain all day. It is also convenient because we are indoors. Graduates, this day is about you, but it is not only about you. It is also about the people, your people, who stood by your side throughout this journey. And I thought maybe just for fun, we'd do a little roll call. Wave your hands in the air when I call you. Do we have any parents in the crowd? Woo! Yeah. How about grandparents? Siblings? Oh, the siblings are loud. I love that. Spouses and partners? How about any children of graduates? I saw some. Yeah. And the aunts, the uncles, cousins, mentors, and friends. Yes, in the back. The friends are very loud in the back. Congratulations to all of you as well. You helped make this moment possible. Let's also take a moment to recognize our extraordinary faculty and staff. Where are our faculty? Wave for us, faculty. They're over there. You have supported our graduates, mentored them, and helped prepare them for the next chapter. We have the best faculty here at the Brown School of Public Health. We truly do. They are not only world-class scholars, but they are just generally good humans who care. Our faculty get a lot of kudos, and rightly so, but it is also our fantastic staff that make this school hum. Just yesterday at the master ceremony, Just yesterday at the master ceremony, Ola, all of you know Ola, I know you do, our security guard at 121 South Main Street. She received a staff award nominated by the Graduate Student Council for dedicated service. It was a huge deal. It was in front of thousands of people, and it was because our students know that Ola's role is important. She matters. She keeps our building secure. She gets people where they need to go. And I know that I start my day a little better because it starts with a smile. So when you see her next week, I know you get Monday and Tuesday off, but when you come in on Wednesday, please congratulate her. Public health is a team sport. I truly believe that anything worth doing is worth doing with others. And the most satisfying, most privileged work we get to do is the work that we do for others. And the work we do for others improves lives. Like, how cool is that? Use the education you received here and all the parts of it, the good moments, the not so great ones, and especially the hard ones. For in that lies the power of a transformative Brown education. I know it was for me. My high school guidance counselor told me that I should take typing instead of a new course, computer programming. Yes, I'm that old. Computer programming was new. Because he told me I should take typing because that was best suited for my career options. Well, it was a good thing that I was as stubborn as a high school student as I am now, because my education and my education at Brown changed the trajectory of my life. I sat where you sat. And it changed my life. And every day, I feel a responsibility to pay that forward to others. It's now time for you to do the same. And it's easy to lose sight. when you're in the weeds of coding and collecting surveys and writing papers. But don't lose sight of what you do and who you are. It's too important. So let me give you a few parting words from an old, aging alum. Don't lose sight of your goals, but don't lose your humility. You can stay proud and still be humble. Don't forget to laugh. A sense of humor, you all know I like to tell jokes, a sense of humor will get you a long way. And don't settle. A public health degree is a Swiss Army knife, and it has equipped you with the tools you need to succeed. I suppose you couldn't all wait till tomorrow or Wednesday to save the world, but today we get to celebrate. So congratulations to you, class of 2026. Give yourselves a round of applause. As we continue our celebration, it is my great honor to introduce our keynote speaker. We often talk about how public health is meeting people where they are. Today's speaker has dedicated his career to putting those values first. In 1985, Dr. Jim O'Connell began caring for people living on the streets of Boston. The city had just won a grant to start a healthcare program for people experiencing homelessness, and Jim was asked to help build it as its first doctor. He thought he'd only do it for a year, but almost 4 decades later, he's still at it as the founding physician and CEO of Boston Healthcare for the Homeless program. Over the course of his career, Jim has helped transform how this country thinks about caring for people experiencing homelessness. He and his colleagues helped pioneer bringing doctors and nurses out of clinics and hospitals to where people are, into shelters, soup kitchens, and onto the streets. It's a model that is now replicated across the country, including right here in Rhode Island. He has inspired countless others to take this community-driven, on-the-ground approach, including myself. Some of you know that I work on a mobile addiction treatment clinic on Friday mornings. In fact, some of our students, some of you have joined me on that clinic, and I have long tried to emulate Jim and incorporate his approach into my own practice. Jim knows that healing starts long before medicine, and he deeply believes in showing up, meeting people where they are, and refusing to let anyone become invisible. That kind of impact is exactly why Jim's work has meant so much to so many people. Not to mention helping thousands of people access care with dignity, stability, and hope, earning him the moniker Saint Jim from some in Boston. Speaking of humility, this man is quite humble, and I'm sure, I can't see him now, but I'm sure the fact that I just brought that up in front of a couple thousand people is making him cringe a little. But it's well earned. Jim is also an assistant professor at Harvard Medical School. The reason he's are you still an assistant professor, Jim? Yes, the reason this man has never been promoted is because he is just out there doing the work. His work has been featured in major medical journals, his own book, Stories from the Shadows, and in the late Tracy Kidder's best-selling book, Rough Sleepers. Tracy Kidder quotes Jim as saying, "Loneliness is really what drives much of what goes on in our world." I think just let that sit with you all as you leave here today and do something about it. Jim's work is a reminder that you are entering a field that needs not only expertise and rigorous evidence, but compassion, humility, persistence, and the willingness to truly see the humanity in all people. Please join me in giving a big Brown University welcome to our 2026 School of Public Health keynote speaker, Dr. Jim O'Connell.
Thank you so much. And there's a lot in that I should revise for you, the Saint part especially. But to Dean Bowden and to the faculty here, and to all of the friends and families and loved ones of the graduates, and especially to all of you, It is such an honor to be here and to celebrate what I think is one of the most joyous occasions we all have. And I'm here to wish you well. And also, I grew up in a time when you never trust anyone over the age of 30 with any advice, so I'll keep the advice to a minimum. But I thought I'd share with you my own kind of crooked journey to getting to medicine and public health. And I thought maybe and it's all about humility, by the way. I can't believe the dean mentioned humility, because that was our total lesson. And before I go into that, I want to make sure the most important thing you should know is that I am, in fact, a Rhode Islander. I grew up in Newport, and I did my pre-medical stuff here at Brown when I was at the ripe old age of about 28 years old. So I have a huge affinity to both Brown and Rhode Island. And I know what coffee milk is. I know what stuffed quahogs are. I've been to Dell's all my life. And I even know why the state is called Rhode Island when it's not an island. And if you need anything, I can share that with you later. But when I was finishing, I was late to medical school. I was 30 years old before I ever got to medical school. There's a long 10-year journey there of driving cabs and tending bar and teaching high school and running a restaurant, living up in Vermont in an old barn that my mother, when she was alive, would never let me discuss. And so when we all go out for a drink later, I can tell you all about that. But I ended up finally finding something that I was passionate about. Got to medical school, did my residency, and I was going to become an oncologist. I was fascinated by palliative care and end-of-life care. And I got waylaid. The dean said it so sweetly. I didn't choose to do this. I got told to do this. And because it was my chief of medicine, who was this wonderful man named John Potts, you will learn this all if you've been in your dean's offices, that most questions are rhetorical and you say yes if you value your career. So I said yes, that I would do it for a year, left Mass General Res training. My last rotation there was to be the senior medical resident in charge of the ICU. And I don't know how many maybe physicians in here, but you have this incredibly inflated sense of ego after you finish doing that. And I went 6 blocks down the street to Pine Street Inn to the shelter, which was an 800-bed shelter at the time. I knew nothing about homelessness. I had never been in a shelter. And I walk in thinking they're going to be thrilled. They have a doctor. And of course, there had been a nurses' clinic there for about 12 years, phenomenally good, independent nurses' clinic. And they were not at all thrilled to have a doctor. So I remember them sitting me down and reading me the Riot Act about how in medicine, medical school and residency, we're trained all wrong. You have to go fast and you have to be efficient. You have to work at the top of your game all of the time. And they said, look, in homelessness, nothing happens until you get to know people. And you have to take time, you have to be present, you have to really listen to them. And I remember thinking that the best skills I ever had for the job I have now is the years of bartending, where you have to listen to people. Anyway, what then went on is I learned that our program it was a grant to the city of Boston, had been put together by a bunch of the mayor of Boston, who had to gather a coalition of homeless people to see how they wanted to be served. So it was my first chance coming out of an ivory tower to understand what a community may want. And interestingly, they wanted all things that were not even in our radar screen. First thing they wanted was continuity of care. They were sick of fragmentation and loss, which was how their lives were marked, and they wanted in their healthcare consistency. So, for example, that's why I got recruited, because they wanted a full-time doctor. They didn't want part-time, and they wouldn't let us use any volunteers because they decided we had to be all about social justice and not charity. I was coming out of residency, and social justice was just not something I was thinking about. So we couldn't use volunteers, we could use students. And I had been a student, they were just part of our lives, because to a homeless person, their view had been that students came out to do their physical findings on them, learn on them, and they were kind of the guinea pigs in the system, and they were sick of that. So all of the things that I had planned to do, all my friends who were going to be volunteers, the students who were going to work with, we had to table for 5 years. We were not allowed to do that. We also weren't allowed to do research, and for those of you who are going into research, it's an interesting long-time tension between advocacy and research, and that could be a whole topic, excuse me, for a whole nother day. But there had been research coming out that showed how troubled and traumatized so many homeless people were. The advocates were saying to the government that we have homelessness because the policy at the federal level had gotten out of low-income housing. And we have homelessness because of that. And here's a study showing that it may be a problem of people, not of lack of housing, and that went counter to what everybody wanted. So we had to learn how to do our job. We couldn't advocate, we couldn't do research, and we couldn't use students. And I remember thinking, well, I hated that. It was probably the best thing that ever happened to us. And what we ended up doing was I got to the shelter. I was trying to show the nurses that I was good, but they made me soak feet for 2 months before I could even become a doctor to them. And there's a lot to be talked about in that. But it was teaching me how to go slow and how to pay attention to people. And then I figured there was a man who came in one night, and I was trying hard to show the nurses that I am a good doctor. I got to show you that I'm good, right? And this man came in, and he walked in, and I'd got to know him. His name was Gus, and he was a really animated guy. He used to scream in the middle with his 800 people now in the shelter, and you could hear his laugh and his screaming above everybody else on any given night. He was just a character. But he came in one night, and he's got his bottle of vodka in front of me in the shelter clinic, and he said, "Doc, you got to do something. I can't swallow this damn stuff." And I was attuned enough to know that's a really terrible sign. I hadn't often ever heard it said that way. But he said he had been able to eat food for a while and it was okay, but once he couldn't swallow his vodka, then he needed to go see the doctor. And it turned out he had a huge esophageal cancer. It was a huge mass. We couldn't do anything. It was way past the time when we could help in any way with chemotherapy or surgery. And we put in a feeding tube to bypass the obstruction so we at least keep him fed. And I sat down with him, told him we maybe only had a few weeks to live, and I was right into my end-of-life care mode. And so I was determined that this poor man who was living in an 800-bed shelter would not die in that setting. So I found a nursing home for him in South Boston, actually not far from where he had grown up. Spent the weekend, this is before computers, you guys, spent the weekend filling out these long forms, and very proudly brought him there on Monday and got him settled in there. And it was a beautiful place, overlooked the harbor, the water in South Boston. And I thought I had done my first good thing. And I came back to the shelter 2 days later, and I'm coming down the alleyway outside, and I could hear his laugh. And I'm like, whoa, what's going on? And there he was, and I went up to see him. There he was, with all his friends, screaming, laughing, having a great time, and pouring his vodka into his feeding tube, right? Just like that. And so, I didn't know whether to, I wanted to kill him, or, come on, what are you doing? And I remember he read me the riot act. He said, "Look, Doc," he said, I appreciate all you did for me, but I was in a nursing home. I didn't know anybody. Everybody was looking at TVs or looking out the window, but nobody was talking to one another. He said, it drove me crazy. He said, this is where I lived. I've been living for 30 years. I want to die here. And all of a sudden I realized the lesson that was probably the most profound one I had is I never thought about what did he want. I had never said, what can we do to help you? And I remember that lesson sort of percolated all the way through our whole program. Is it how do you go to wherever people are, accept where they are, and then gently nudge them in the direction you want, but accept if they don't want to go. It was so hard to do when we were so used to healing and curing in the hospital and fixing. But anyway, I share that with you because this was the entry, and now I'm easing into public health. So one of the other people I saw that same week was a guy who came in the staff was worried about. I examined him and said, he's okay. He's been drinking too much and doing so, but I can't find anything really wrong with him. And 2 nights later, he comes in. He had normal vital signs, no fevers. He comes in 2 nights later, and we have an old x-ray machine at Pine Street. So we took an x-ray, and it was cavitary tuberculosis, hugely, right, in every lobe of his lung. And he had probably had that for months and months, which is why he didn't show many symptoms other than the usual cough. So he became the first case, or the index case, of what turned out to be 60 cases of active pulmonary tuberculosis in that shelter. And I'm now the doctor, realizing I don't have a clue how to take care of this. It was like me being thrown into a world that is entirely what you know, public health. And that's when I learned essentially what the dean said so wonderfully is it's a team sport. To take care of these 60 cases, and by the way, it was one of the first multi-drug resistant outbreaks we've had, at least in Boston, and it was resistant to INH and strep. And we had to get 4 medications to everybody for 18 months to treat that. And if we didn't do a good job, this TB was just going to keep spreading. And to make matters even more complicated, in this 800-bed shelter, about 40% of everybody converted their PPDs from negative to positive. So it was a huge reservoir of potential infection. So that's when I learned that we worked with a specialist from Boston Medical Center. I was Boston City Hospital in those days, a pulmonary specialist. We worked with a state and city departments of public health. We had outreach nurses. Everybody in the shelter pitched in, and we used everybody to try to treat this. For me, it was the first time we did what we would now call street medicine to get to these people, most of whom didn't come back to the shelter because that's where they got sick. We had to get on our bikes and bring them their medicine every day. And I'll never forget that we realized this is tricky, but we have to get the whole community going. And I, having been a bartender a long time, right? I had a great friend who was at J.J. Foley's, and several of the men, there were 7 of them, and by the way, this outbreak was all men. It was pre-AIDS, so nobody was immunocompromised. And the men would stop at a bar and get drinks oiled up, as they would say, before they came into the shelter, where you can't drink once you're in the shelter, but you can come in any state of inebriation or not. So the bartender agreed to give them their medicine every day before he would pour their beer. And so for 18 months, the bartenders at this great little place called J.J. Foley's did all of the treatment. We would check in and make sure it was all done. And then there was a barber in South Boston who had a coffee clutch in the morning, and he did the same thing with 4 men, and he would make them take their medicines before they got their coffee in the morning. So I sat back and realized this is like a miracle. You know, this is the village taking care of everybody. And by the way, everyone got treated except for one person. No one died. And that was the first time I ever met Paul Farmer. You guys must all know Paul. He was a student when I was first doing this, and he came down as a student to Pine Street Inn. And if you know Paul, you realize he was never much of a student. He was always much more of a professor. But Paul came down and he was fascinated by how Boston was doing what eventually became directly observed therapy. And he pointed out that strategy, which was happening, by the way, 2 blocks from Tufts, 6 blocks from Mass General, and maybe 3 blocks from Boston Medical Center, Boston City Hospital, we were treating it like it was a third world country. And he pointed out that when he then later on went to Peru to do directly observed therapy, he used the same strategy that had been used in inner city Boston to do TB in Peru. And then eventually, he went on to become, magnificent in so many ways in an international vein. But here's the other humility lesson I would have. So I learned a lot from that. I learned that you can't take care of a homeless population by just going out and doing things out there. You have to have continuity of care. It has to go from out there to when they're sick, to be able to bring them in to the hospital, take care of them with specialty care, and then have places for them to go afterwards. And in our case, we had to come up with a respite program, which is a place where you can come when you've been sick, but the hospital's ready to kick you out, but you're way too sick to be in the streets or not. And then Paul would get up, I'll never forget this, he'd get up and embarrass the bejesus out of me. We'd be doing panels together, and he'd get up and he'd introduce me as this poor doctor from Harvard who had never gotten more than a mile from medical school. And then he would talk about what he had done in Rwanda and Haiti and, in Lesotho, Peru, everywhere, Russia. And Paul really was, in many sense, the hero to all of us. But he would always come around. This is a lesson I'd want to share with all of you that, has captivated me. But then he would always come back and he'd say, but can you believe that they are finding the same things a mile from our medical school that we are finding in Haiti and Peru? That the disparities in health can permeate our communities often when we don't even see it. So I would urge you, when I think of you as being, our future, that there is so much need out there. And people are, I would argue again, so lonely and so need of people that are going to, the word continuity that we said in the beginning eventually became accompaniment. So I think it's all about how do you get to know people, how do you walk with them, whether it's light or darkness, and let them know that you're with them. And when you do that, then health becomes possible. And I would want to just urge all of you, because I know you've been listening to people all day and you've been wet and everything else, but I would just urge you to remember that public health is really what's going to help us all come together and solve these problems. We can't do it in medicine alone. We can't do it in housing alone. We're going to need to do it with all of us working together. So I urge you, to have just great fun and not get discouraged by the divisions at the international, national level, but just dig into the need that is in front of you. And you will find, I think if you work hard, focus on that, you will find all sorts of things where you will be helpful, ease suffering, and really change the world in small ways. So I'm so honored to be here, and I don't want to go on any further other than to say thank you. It's just such a privilege to be here at Brown, and congratulations to all of you and to your families. Okay, thank you.
Okay. Thank you, Jim. That was wonderful. Now the moment you've all been waiting for. We're moving on to our degree presentations and acknowledgements. I feel like you all should have cheered for that. Yeah.
Fope folua akinyede. Ada bugwu anamekwe. Amara Kel. Susanna Oluwafumike Awabajo. Tinasha Beyonce Barnwell. Olivia Simmons Bergen. Alex Minwoo Chang. Kate Choi. Thomas Lawrence Cronin. Michelle Demden Choinbull. Camille Elizabeth Decky. Marina Demas. Zahra Fayek. Olivia Athena Fox. Marty Kiniso Gemachu. Noah Leonard Gomes. Masuma Haidari. Olivia E. Hall. Elijah Andrew Harris. Ruviha Ayunahoma. Coco Huang. Kara Elizabeth Hutton. Safwan Islam. Naomi Jack. Pierre Vincent Jolin. Samuel Raphael Lederman. Judith Jiyun Lee. Grace Liu Lee.
Ari Marcalunas. Jacely Marie Martinez Rivera. Alejandra Sol Mineo Levitsky. China Inamani. Lauren Isabella Olson. Elizabeth Kristin Oluvayemisi Soyemi. Hibo Ahmed Osman. Vicky Poo. Jerry Kwan. Naomi Rochelle Reisman. Vijay Nal Malakel Ramakrishnan. Shrita Reddy. Jody Ann Robinson. Samantha Rosario. Shakriya Saki. Alexia Sanchez Contreras. Michelle Santos. Alyssa Sherry. Sara Sultani. Hamid Torabzadeh. Mia Gabrielle Turner. Alvaro Amir Uribe. Dominic Alfred Andrew Vault. Lucy Yu. Victoria Emma Zhang. Dido Watara. We will now present diplomas to students who have earned a Bachelor of Science with a concentration in statistics.
Nicolas Fernandez Baygun. Charlie Castillo. Charles Alexander Cho. Sophie Gideon. Grace Chuen Mei Lee.
Bailey Joseph Smoko. Yeju Srivastava. Pooja Yurnani.
Julia Costin.
We will now acknowledge our graduate students who received their diplomas in ceremonies earlier this weekend. We invite the graduates who earned a doctoral degree in behavioral and social health sciences to the stage.
Amelia Gabrielle Bailey. Chase Michael Breyer.
Ugoji C. Wanaji and Wareham. Siobhan Nicolette Mulhall Perks. We invite the graduates who earned a doctoral degree in epidemiology to the stage. Ralph Amawanyu Welween.
We invite the graduate who has earned a Master of Arts in Behavioral and Social Health Sciences to the stage.
Abigail Itzel Morales.
We invite the graduate who has earned a Master of Arts in Biostatistics to the stage.
Chris Korkulakos.
We invite the graduates who have earned a Master of Science in Biostatistics to please come to the stage.
Yanhao Ji. Shen Jiang. Valentin Kevin Kirilenko. Siqi Li. Yue Li. Manfang Liang. Ian Liu. Jingro Liu. Meng Yue Liu. Ashley Maria Lockwood. Shuyan Luo.
Kai Dong Mu. Yuzhou Peng. Dwight T. Ross III. Shansu. Yiyun Wan. Dipeng Wang. Zizhao Xie. Aijia Zhang. Zinan Zhao.
We invite the graduates who have earned a Master of Science in Healthcare Leadership to the stage.
David G. Epstein. Alyssa J. Grant.
Dana Joanne Reisner. Laura Lynn Tongi. We invite the graduates who have earned a Master of Public Health to the stage.
Kevin Paul Haynes. Owen Patrick Leary.
Jalen DeAndre Nix. Yasmin Banu Sheikh. Sadman Intesar Zaman.
Ipek Kirach. Ella Aburjali. Aditi Ashisha Kolkar. Punava Alam. Amaya Simone Allen. Anthony Arengo. Yanessa Pauli Baez Gonzalez. Dominique Tasha Bannerman. Benicio True Beatty. Isabel V. Boulier. Andrea Chavez Romero. Allison Aiko Kayulani Ching. Mia Kate Cooper. Emma Cortez. Madeline Grace DeWitt. Saud Ahmed Dillon. Haley Michelle Dorsainville. Farah Fasihuddin. Cameron R. Cooper. Sarah Chambers Garcia. Megan Korguman. Mallory Go. Pallavi Goyal. Zuxian Hao. Ali Hawk. Karis Elizabeth Haynes. Victoria Elizabeth Hippen. Graham C. Huntington. Gregory William Herder. Alex Ivanchev. Jerome Sungbin Jacobs. Charmine Jaffrey. Aaron Miles Johnson. Mary Caroline Kelly. Hanul Kim. Minche Taylor Kim. Charla Darnay Kirkpatrick. Victoria Elizabeth Hippen. Rami Lucianko Toby. Jacqueline Lee Larson. Victoria Elizabeth Hippen. Zi Ying Lao. Quinn Min Phuong Lei. Lin Lee. Greta Marie List. Campbell Meredith Loy. Nelly Paola Lopez Mendez. Peyton Bailey Louise.
Mayor Andres Manlapid. Constance Olivia Fernandez Morangen. Christopher Abreu Martins. Akshara Nilesh Masurkar. Lauren Ashley McCabe. Nicholas McCarthy Balash. Mia Claire McKinney. Miranda McKenna Mergens. Monica Kamaya Denise Moore. Lydia Moriku. Lance Michael Nelson. Devin Reese Newman. Jada Alexis Owens. Rashi Umesh Patel. Erin Mary Pickert. Hannah Chio. Asael Rafat. Lily Isabella Rayer. Marco Antonio Reyes. Ambry Robinson. Sarai Camila Sales. Isabella Schultz. Anae Lauren Scott. Ishan Mega Shah. Sonal Deep Sharma. Carson Olivia Shoemaker. Kalista Ileana Sicard. Jake Thomas Stevens. Yija Sun. Olivia Gabrielle Taylor. Lauren Sidney Thomas. Marimar Vasio Lasalde. Yulia Velhan. Yana Verbova. Jasmine Renee Warren. Danielle Samantha Wisnant. Andre Andrade Williams Hanna. Yue Yang Zhang. Kaylee Jolan Smith.
Zaina Brianna Ake. David A. Allenson. Ariel Maranatha Araujo. Dana Nicole Barclay. Lisa Bauer. Hannah Elizabeth Bedrosian. Stacy Burnett Harrison. Carlo Gabriel Castillo. Sia Oxen Chen. Jae Taegyun Choi. Karis Elizabeth Haynes. Alexandria Dawn. Nicole Mary Donahue. Donald Ray Edwards Jr. Gotham. Aaron J. George. Lauren Elizabeth Haynes. Sulin Pabnahak. Angie Kai Herman. Zoe Kandakai. Elizabeth Lawton. Jong Sun Jenny Lee. Gina Lim. Avery Lopez.
Parmita Magsudlu. Jessica Marquez Sanchez. Pooja Menon. Karis Dorothea Miller. Samantha Marianne Moreno Ulibari.
Sailor True Lautchenko.
Emily Caroline Pavano. Meredith K. Naylor. Jill Eve Naylor. Naveed Nickpour. Kira Chang Phillips. Lauren Mariah Rani. Idalis Yanil Rivera Ramirez.
Amy Elizabeth Shockley Hires.
Claren Bridget Ruth. Jane Lauren Sapeg. Michelle Sheen.
Priscilla Solomon.
Visitha Srikanth. Ashley Brianne Stacy Badapati. Ronald Harris Tanner. Jennifer Shuruk Schenkenfelder. Valeria Silvina Tierney. Sapphire Renee Tubbs. Guinevere Lynn Feldman Vogel. Erin Cynthia Whitman Jemison. Seble Wolde. Roxanne L. Wood. James Frederick Patrick Young. Mehek Fatima Zedi.
There we go. I'm loud, but I'm not that loud. Well, thank you all. Thank you, friends, family, and guests. I present to you the Brown University School of Public Health Class of 2026. Congratulations. Commencement has now closed. Go celebrate and stay in touch with your Brown family. Congratulations.